What is the purpose of Fallen's test? A. To assess for knee joint stability. B. To evaluate shoulder flexibility. C. To test for carpal tunnel syndrome. D. To measure ankle strength. And the correct answer is C. To test for carpal tunnel syndrome. Fallen's test is used to test for carpal tunnel syndrome. Fallen's test involves flexing the wrist for a prolonged period to see if it reproduces symptoms of carpal tunnel syndrome, such as numbness and tingling in the hand. If these symptoms occur, it suggests that it's carpal tunnel syndrome. Which of the following treatments is given for sickle cell anemia? A. Antibiotics. B. Insulin. C. Hydroxyurea. D. Both A and B. And the correct answer is C. Hydroxyurea. Hydroxyurea is commonly prescribed for sickle cell anemia to reduce the frequency and severity of complications. Sickle cell anemia is a special kind of blood problem that some people have from when they are born. Normally, our blood has red blood cells that are round and soft like donuts. But in sickle cell anemia, the red blood cells are kind of like hard, pointy shapes like a banana. These hard, pointy blood cells can get stuck in our blood vessels and make it hard for our blood to flow. That can hurt and make us feel sick. People with sickle cell anemia need to be careful and go to the doctor a lot to stay healthy. They might also need special medicine to help their blood work better. It's important to know that it's not something anyone chooses to have. And kids with sickle cell anemia can still do lots of fun things and be healthy with the right care. De-escalation of antiplatelet therapy in the first 30 days after an ACS event is A. Recommended. B. Should be considered. C. May be considered. D. Not recommended. And the correct answer is D. Not recommended. ACS stands for Acute Coronary Syndrome. ACS is a group of conditions that involves a sudden decrease in the blood flow to the heart muscle. ACS includes conditions like unstable angina and heart attacks, that is myocardial infarctions. It is a serious medical emergency that requires prompt medical attention and treatment. In this question with de-escalation, they are referring to a chance of decreasing the dose of antiplatelet therapy. De-escalation of antiplatelet therapy in the first 30 days after an ACS event is not recommended, because this initial period is characterized by a high risk of recurrent cardiovascular events, including stent thrombosis, which can have serious consequences. Antiplatelet medications such as aspirin are important for preventing blood clot formation and maintaining stent patency during this vulnerable time. Any modification or de-escalation of therapy should be done only after careful assessment of the patient's specific risks and benefits, typically beyond the initial 30-day period, to strike the right balance between preventing recurrent events and managing potential bleeding risks associated with these medications. Which of the following is the antidote for the anticoagulant medication dabigatran? A. Vitamin K. B. Fresh frozen plasma. C. Idarucizumab. D. Protamine sulfate. And the correct answer is C. Idarucizumab. Dabigatran is an oral anticoagulant. Dabigatran is used to prevent blood clot formation and reduce the risk of stroke and systemic embolism in AF, deep vein thrombosis, and pulmonary embolism. Idarucizumab is a specific antidote for dabigatran. In other words, it is a medication used to rapidly reverse the anticoagulant effects of dabigatran in emergency situations. Imagine you have a patient who has been taking dabigatran for atrial fibrillation but presents to the emergency department with severe bleeding due to traumatic injury. In this situation, the use of idarucizumab becomes important. What type of fracture is Danis-Weber classification primarily used to classify? A. Pelvic fractures. B. Lateral ankle fractures. C. Femoral neck fractures. D. Vertebral compression fractures. And the correct answer is B. Lateral ankle fractures. The Danis-Weber classification system is commonly used to categorize lateral malleolar fractures of the ankle. It helps determine the severity of the fracture and guide treatment options. Which medical condition is the Wells score primarily used to assess? A. Diabetes mellitus. B. Deep vein thrombosis. C. Hypertension. D. Asthma. And the correct answer is B. Deep vein thrombosis. The Wells score is a special tool that doctors use to check if someone might have a problem with DVT in their legs. They look at things like swelling or recent sickness and give points for each. If you get more points, it means you might have a DVT. The doctor uses these points to decide if you need extra tests like ultrasound to be sure. So the Wells score helps doctors know who needs more tests for diagnosing DVT. Which of the following syndromes primarily affects the connective tissue in the body? A. Down syndrome. B. Marfan syndrome. C. Tourette syndrome. D. Asperger syndrome. And the correct answer is B. Marfan syndrome. Marfan syndrome is a genetic disorder that affects the body's connective tissues, leading to various health issues, including heart and skeletal problems. People with Marfan syndrome are often tall and slender with long limbs. They may have physical features like a curved spine or chest deformities. This syndrome can cause serious heart problems like aortic aneurysms or dissections. Regular checkups are important to monitor and manage these health issues. Treatment may include medications or surgeries to reduce complications and improve quality of life. What is the primary purpose of the CIWA score in medical practice? A. Assessing cognitive function. B. Evaluating liver function. C. Measuring alcohol withdrawal severity. D. Diagnosing respiratory conditions. And the correct answer is C. Measuring alcohol withdrawal severity. CIWA stands for the Clinical Institute Withdrawal Assessment for Alcohol. It is primarily used to assess the severity of alcohol withdrawal symptoms in individuals who are experiencing alcohol withdrawal. Which of the following organ is primarily affected by Wolff-Parkinson-White syndrome? A. Liver. B. Lungs. C. Kidneys. D. Heart. And the correct answer is drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.